Uh,
Let's start with our session formally. Bismillah ar-Rahman ar-Rahim. I hope all of you can hear me well.
Yes.
Yes. Great.
yes.
Dear all SISMI members and participants,
Yes.
Assalamu alaikum. I welcome to all of you to this webinar arranged by Saudi Society for Medical Education Riyadh Office General Club. I'm Dr. Shazia Iqbal, Chairperson and Organizer for Continued Professional Development Activities at Saudi Society for Medical Education Riyadh Region. Being medical educators, we need to train future physicians to be accountable for the current and future needs of society. We need to prepare them to deal with the challenges that may occur in society. So all the medical schools are required to have programs for accountability to the community about education, research, and services. Therefore, nowadays, there is an urge for changing medical education program based on accountability to the community. The aim is to make the graduates more capable of identifying the healthcare problems of community and maintaining public health. This session will highlight the underpinning of social accountability in medical education, how medical students should be taught to understand the need of society after graduation and adapt themselves to the changing expectation of community during development of medical sciences. The topic for today's presentation is social accountability in medical education, and I'm very much honored and delighted to present our distinguished speaker, Dr. Muhammad Alhassan Abdullah Al-Sayyed. Very warm welcome to Dr. Alhassan to SESMI Riyadh office. Dr. Muhammad Alhassan graduated his MBBS from Faculty of Medicine, University of Jazeera, Sudan. Then he got master's and PhD degree in health professional education, and he's fellow of Academy of Medical Educators, UK. He has work experience as a medical educator in Sudan, Saudi Arabia, UAE, Ireland, with a lot of contribution in medical education in different countries. He's working as senior registrar in medical education school of University of Limerick, Ireland. He has membership and affiliations to regional and international organizations. He is co-chair for Task Force of Social Accountability and Accreditation, the network TUFH. He is chairperson of Group on Social Accountability, Association of Medical Education in the Eastern Mediterranean region, and he is chairman of Group on Social Accountability, GOSA. He has several publication and research interests in medical education with special interest in social accountability, learning and teaching, accreditation, cost, and value. So I would like to welcome Dr. Hassan to this webinar. And before we start, I would request Prof. Khalid to say a few words and then over to you.
Thank you, Dr. Shazia. And I'm so glad to welcome our brother and our best friend in medical education, and also a close friend. I know him since the CIMIC, I think CIMIC 2010, that was organized by Jazani University. And I know that our brother, Dr. Muhammad Al-Hassan, very keen, very energetic in the field of medical education. And he was really one of the most active people that I know to spread the most innovative approach in medical education around the kingdom, as well as in the GCC when he moved to UAE. I'm so glad that we also offer or invite brothers and sisters from Saudi Arabia, from Arab countries, to participate in our activity. And I think we have a lot to share. So last webinar, we invited Professor Abdulah al-Murzi, and he presented a very organized, very informative talk. And now we also glad to have Dr. Muhammad. So inshallah, in future, we have our colleagues from Saudi Arabia, from Arab countries to join us so that we can, inshallah, enhance this very big and important mission of promoting medical education in the society. So welcome back, I say, Dr. Muhammad, and we are all keen to hear from you. Thank you.
Yes, yes, Dr. Muhammad.
Okay, thank you very much, Dr. Shazia, and thank you very much for Khalid for the words. And I'm always happy to be with you, whether today or at any time, and whatever we can participate, we will always find us in the front line, inshallah. Let us start our talk. Our talk will be around social accountability in medical education, as Dr. Shazia mentioned. And social accountability in medical education has a root and has a good development. And it resembles the development of other sciences, because in all other disciplines, there was a science dominates in the beginning, and then it moved to society dominates. So when we apply this to medical education, if we consider Flexner report in 1910 as a starting point for the modern medical education, it started as discipline-based, and then when another milestone comes in medical education, which is the Alhassan Declaration in 1978, we moved towards community-oriented medical education, community-based education, and then in 1995, the concept of social accountability starts, which consider the three functions of medical schools, which are the education, research, and service. And I'm going to explain this in a minute. Also, the concept of social accountability, it fits well with the concept of citizen empowerment, which is adopted by the World Bank, and it moves from the economy to all disciplines. And medical education cannot be away from this. So we need to empower people because we are working for people. So this citizen empowerment, it gives them the right to ask us, and it gives them the right to ask about what is the benefits of those medical schools, what is the maximum benefit that we can get from having a medical school, and what is the maximum benefit that we can get from the activities of medical school. So for all those concepts and all those developments, the concepts of social accountability starts and evolve. When we look into the how can medical schools relate to societies, we can have four categories. The first category, which is called neutrality, where the medical schools performs their functions with little concern or no concern to any of the needs of the surrounding community. And you may be surprised, but there are medical schools who are doing this. And there are a lot of examples where the medical schools are living in ivory tower. They don't have any connection with the community, and they think only about the science that they are providing to their students. The second category, which is called social responsibility, where the medical school is aware about their duties to the health of the society. And this usually represented by the community-oriented medical education, where medical schools are teaching the students the common health problems. Another category is socially responsive, where the college or the School of Medicine or the Faculty of Medicine has more communication with the community, and they use the community premises for teaching and learning. And here the example is a community-based education, where we go to the health centers and we use the community population for teaching. So there will be more communication with the community, and also the students will have like real life teaching on the problems that the community have. What is new with social accountability is that social accountability is considering not only the education, not only the curriculum, but considering the other two functions of medical school, which are the research and service. So the definition of social accountability is that the medical schools are obligated to direct the three functions: the health of teaching and learning, and research and service, the priority health concerns. But who is going to define those priority health concerns? We are not the only people who can define the priority health concerns, because the community, they must have a role in defining their needs, the other partners. So when you talk about the priority health concerns, those are the concerns or the problems are identified by all those people. And not only problems, because the idea is that we need to anticipate the problems. So in community-oriented medical education, in community-based, we deal with problems, health problems. But in accountability, we need to anticipate the problems, so we can help promote health even before the problems happen. And these are the three categories. And if you look into this diagram, you will find accountability, responsibility, and responsiveness are a continuum of how the relation with the community can be happen. So we can only be community oriented, or we can do more effort in our medical schools to be responsive and add community-based education, or we can be even proactive to include other activities in research and service, so we help the community more, and we will be more accountable to the community and to the society. Since 1995, social accountability moved to be top in the agendas, especially after the publication of the Global Consensus for Social Accountability, which was published in 2010, and 100 years after Flickr report. And this consensus was developed by like 130 organizations that have responsibility to medical education: WHO, WFME, other regional organizations with experts in medical education who met in South Africa and developed this consensus. Then, after that, the WHO published what they call the National Work Health Force Accounts, where they mentioned that the work health force, they should be socially accountable. And to be socially accountable, they need to be taught in a social accountability environment. And there are a lot of conferences conducted in medical education. The most important one is the Tunisia declaration that was developed in 2017. And when it comes to the WHO, their draft plan for 2019-2023, they mentioned that the education of work health force should be socially accountable. And when they talk about the education of work health force, that means we in medical schools and other health professions, we need to adapt ourselves to this. Otherwise, we will be lagging behind, especially that the WHO is the body who is responsible for health all over. The global consensus for social accountability why it is making social accountability high in the agenda, because the social accountability of medical schools describes that the medical school should respond to current and future health needs and challenges in the society. And this is a noble objective, that we should respond to the current. So we are dealing with the community right now, but we should remember always that we are graduating students to work in the society after 5 years. So if we do not prepare them for what will happen after 5 years, that means when they are in the field, they will be out of date. So this is a challenge. How can we determine the future health needs? To do this, we have education, service, and research. So we need to reorient them to the priority health concerns according to the plans that we set to anticipate for the future health needs. We cannot do this alone, because we are is one sector, which is education, but there are other sectors who are working in the health system. The health system itself, the ministers of health, maybe NGOs, other partners. So we need to work with them. But what is going to let medical schools or to encourage them to adopt this change is the accreditation system. So we need to use evaluation accreditation systems so we can assess the impact. So now I'm going to talk about this in a minute, but the accreditation system right now is considering the processes. Do we have a good written curriculum? Do we have enough resources? Do we have 1, 2, 3? But the important is that what is the impact? What impact do we have on our societies? What impact do we have in the health of our people? This should be the concern. Yes, good process is important, but we cannot ensure good results only if we have good processes. So this is a dimension in improving social accountability. The global consensus talk about 10 strategic directions that, if followed, we are going to improve our relation with the society from being responsive to responsible to accountable, or even from those who are in the neutrality category. So we need to look into them, and most of them are around how can we ensure that we are adapting ourselves, adapting our functions to the priority health of the communities. Social accountability fits well with the health system orientation, because there are 2 major milestones in the health system, which is the Alma-Ata Declaration and Astana Declaration. And the key factor, the key point in both milestones is that we need to satisfy the society health needs. So when we are adopting social accountability, that means we are going or fitting with the health needs orientation, which is to satisfy the health needs of the societies. Also, social accountability fits well with the orientation of the work health force. When we are describing our work health force, we need those people who are fit for the purpose. If you are graduating doctors, if you are graduating nurses, if you are graduating physiotherapists, we need them to fit for the purpose that they are doing. And we need them to work in the context. So even if they are graduated from anywhere, when they come, they have to have the ability to adapt themselves to the context where they are working. And all health workforce are responding to changing health needs. And I think this is was very clear during the pandemic. All the health system, all the health workers, they reorient themselves to respond to the changing health needs. So they need to be prepared earlier for those roles. And we hope that the work health force will be change agent, not problem solver. So we don't need them only to wait for the problems to happen, but they have to promote health. And I always say that the word doctor in Latin means to teach, not to treat. So we need to teach people how to be healthy and not to wait for them to become ill and then we treat them. So with the descriptions of the work health force, it fits very well with the social accountability principles that we need to implement in our medical schools. Social accountability works with 4 values, which are the relevance of education, service, and research, the quality of education, service, and research, with cost effectiveness. It's not quality that people cannot obtain, and with equity. And I think every one of us and every system is trying to adapt those values so they can have the maximum to the societies. So again, this has raised the position of social accountability high in the agenda. Okay. What is the implications of this? What is the implication of having this description of social accountability on our work in medical schools? The implication in the curriculum, that means we need to have a flexible curriculum to be aligned with the health needs. So we need to have a core curriculum, which is basic for a doctor, and we need to have electives, which may be changed according to the changing health needs and according to the anticipation. So we need in those electives to include humanities studies, study of global health, health system studies. And this is important because one of the things appear during the pandemic is that we as doctors who are not prepared to the health system studies, because now people who want to have health system studies, usually it's a postgraduate. But when it comes to the pandemic, we find that everyone should have a knowledge about how to manage the health system. Because if you are a doctor in the ER during the pandemic, it's a whole health system. So these things we need to know, and we need to find a way on introducing them. Health economics, everything now is about money. And the economics of the health system are changing. So we need to prepare our students for this, or the future graduates. Professionalism, cultures and diversity, tolerance, social determinant of health. So all those things we need to include in the curriculum. So when we have graduates, they can keep with the society needs and not away from society needs. This also may lead to interprofessional training. A lot of people talk about it. We have years and years, keep talking about interprofessional training, about learning together, working together, but still we cannot have a model of interprofessional education. So we need to think about how can we create that model of interprofessional education that can graduate a work health force who can work together in the future. In the teaching and learning, we need to include the service learning and to move ahead of the community-based education. In the community-based education, we take the students to learn from the patient. But in service learning, we need the students to serve patient first, then to come and reflect about their learning. So we move the students ahead from just applying what they know to initiate the service for the community, and then learn from that service that they provide. So it has many benefits, and it has hidden curriculum that we can have, and it lead to more engagement of the students with the community and more engagement of the college or the school with the community. So not only the teaching and learning, but we need to think at the level of the educational tools. Do they fit with our needs? Do the cases, for example, here this inventory we developed to assess the social accountability principles in PBL cases. Do the PBL cases that we use are going to tell the students about the health system, are going to tell the students about the referral system, are going to tell the students about the values of equity, quality, cost effectiveness, and relevance? So we need to think about it in order to develop those graduates for their function in the future. The assessment system needs to go from the assessment tool to the assessment system. So instead of thinking about each tool differently, we have MCQs, we have OSCE, we have essays, or we have R-type questions. How those tools together can be a system that can tell us that this person or this graduate is socially accountable and can work well in the community. Again, remember that we do all our functions years before the graduates can go to the society. So we need to have all the principles or all the systems that can tell us that we will have impact on the society based on the work of that graduates. So we need to go away from the tools to the system. When we develop the system, then the tools can be easy to be developed. But if we concentrate on the tools, it's very difficult to put it to have a system. This is for the education. For the research, we need to think about the priorities. How can we define the priorities of research in our colleges? Is it only based on the researcher interest, based on the funding availability, or based on priorities that will lead at the end to the improvement of quality of life for people and improve care for patients who are already ill? If we think about like this, we can find other funding. We can build interest. This does not mean that we don't have a research at the genomic level. Because again, when we have a genomic level research, that means also we are helping patients and we are helping developing the quality of life. But is it a priority? And what type of genomic research that we need to do, for example, in Saudi Arabia? So we can help people in Saudi Arabia, or we can help people in that country, or we can help people in that place. And also, when we have such a research, although we are concentrating on the countries that we have or the populations that we serve, we need to always consider that we are part of the globe. So the community in social accountability starts from the direct community, which is in relation with the medical school, up to the nations that we are serving. This is very important because sometimes people think that social accountability is about confining ourselves to the community that we are in direct relation to. No, community in social accountability has levels. You have the community you are in direct relation to up to the nation that you are serving. And this is very important people to have it in mind when they think about the education and research and service. When we think about the service that we are providing as colleges or as faculties of medicine, we need to have health impact and health outcomes. So if you are providing a service, we need to know exactly what health outcome we are serving and how that health outcome will fit with the general plan of the health system in the country or in the place where we are serving. Again, we have expertise in our colleges, and we want to use those expertise to provide health service. But those expertise and those health services should be part of the general health system of the community and part of fulfilling a health outcome in or outcomes in the health system. If we do this, in general, we are fulfilling our obligation to serve the community and through addressing their health needs. But again and again, we need to build partnerships because we are not the only players in the field of improving health status of the communities. There are other academic institutions, there are health administrators, there are communities themselves, there are policy makers, and there are the medical schools or the health professions. So how can we build such a partnership in a way that we complete each other rather than compete each other? It's not easy because each field has their agenda, but if it is possible to bring us to a common agenda, that will be helpful for the community first and then for each of the partners. So completing each other and not competing each other, this is the key for partnership if we would like to be socially accountable. The social accountability has implication on the accreditation standards. As I mentioned, that we move from process standards to outcome standards. What is the outcome of being there as a medical school? What is our impact on the society health? What is our impact through our research? What is our impact through the service that we provide? What is our impact through our graduates? This does not mean to ignore the process standards, but we need to consider this. And the situation now is improved, but earlier we did a study and we found that the process standards are almost 70% to 80% of the standards in accreditation standards, in the WFME standards, in the AMC standards, which is Australian, and the LCM standards, which is American, 70 to nearly 80% are process standards. And around 10% are content standards, which is how the curriculum is developed or what is the content of the curriculum. And very few standards are outcome standards. So now we are accrediting medical schools based on the processes that they have. It's good, but we need to increase the level and increase the amount of outcome standards so medical schools can work towards having an impact on their societies. In each medical school or in each context, there are enablers. So we need to think about, if we agree on social accountability, how can we enable social accountability? So the vision and the mandate of the medical school is important. If the vision and the mission of the medical schools is towards serving the community, then you have to make the maximum to achieve your mission. The leadership, accreditation standards, what measurements that we have, what is the structure of the medical school? If we say that this is a work of the community medicine department, then we destroy the idea. If we set an office for social accountability, then it will be that is the job of that office or the job of that wakil kulliya. Why should we do it? Social accountability should be there in each activity. Because if the mission and the vision of the medical school is to serve the society, then it should be an activity or the function of every part of the college. And I don't think there is a single medical schools which set a vision or a mission without mentioning serving the society. So we need to have this alignment between our activities and the missions that we set. And here comes the role of the accreditation, because the accreditation, if it concentrates on the missions, that means they should concentrate on the impact, on the outcome. So these things will enable us to be socially accountable, whether we mention that we are socially accountable or not, but the outcome will be more work with the society and more benefit to the society. What does social accountability mean for Saudi Arabia? We need to fit for purpose in medical schools in Saudi Arabia. Now, there is a Vision 2030 in Saudi Arabia, which is a big movement. How medical schools are preparing themselves for this Vision 2030, not only at the level of the structures and policies, but at the level of the content of the curricula. Do we need to do some changes to fit with this? Because a lot of changes are expected. And any change in the society, whether socioeconomic or economic or whatever, it will be reflected on health. So are we ready for this or not? In Saudi Arabia, there is characteristics of the community. Are they reflected on our curricula? Are they reflected on our plans for service and research? The comment by Janet Grant on the Saudi Med is important, that we need to see the Saudi persons in this profile. It's not only about what he or she can do, but about how he or she can represent Saudi Arabia. In Saudi Arabia, we have Hajj wal Umrah, which is something big, and it has effect on social determinant of health. How those Hajj wal Umrah are represented in our curricula? It is not only for Al-Qura, for example, to include it. And it should not be something like one course, but it should be there, interwoven in all the curriculum. Because this is something important and it has effect on the social determinant of health, definitely. Whatever educational tool or curriculum or assessment tool that we need to have in Saudi Arabia, we need to adapt it rather than adopt it. So, is PPL the best way to teach students in Saudi Arabia? Should it be the same way it is done in for example, Maastricht, or we need to think about how can it fit with the Saudi community. And there are examples like this. For example, in team-based learning, all the literature comes from the Western countries. It says that the group should have a mix of males and females. But the study done in Oman, they mentioned that they found when they have a group of male and a group of female, the discussion is more deep. So this is a cultural issue. It doesn't have anything to do with the team-based learning. So whatever things that we have in Saudi Arabia, we need to wait with the characteristics and of the Saudi community. Definitely, always we talk about the accreditation. The accreditation standards in Saudi Arabia is fit for the all higher education. Maybe we need to think about additions to those standards to promote social accountability in medical schools. And to be, I cannot say that it is only different accreditation standards for medical schools, but maybe you need to add something in addition to those we have, so medical schools can be promoted to adopt those developments. I'm sure that there are many medical schools in Saudi Arabia who are doing a lot of work with the community and to the community. But I found in Jazan, they mention it in their strategies, which is good. And it's something that they can do. And I know that Jazan, they got accreditation sooner, so they will be obligated to do what they have written. And also we help our colleagues in Qasim. They did evaluation for their level of social accountability, and they define gaps or how can they move forward. So I hope other medical schools, they can follow the same things and to improve our level of social accountability. Having said all of that, there are a lot of challenges facing social accountability. Is it accountability or responsibility? Accountability means musa'ala. Do we need to be responsible or do we need to be musa'alin? This is something that has a lot of discussion. And the other thing or the other challenge is that social accountability is a context related. So we cannot adapt or we cannot adopt what is happening in any place to our place. So we cannot say that, like, for example, Northern Ontario in Canada now is a leading college with social accountability. We cannot take its determinants and apply it in Saudi Arabia or in Sudan or in Pakistan. We cannot do this because it's a context related. So we need to build our own determinants. The misalignment between the education and health system, this is something universal. Instead of thinking together, we're thinking as different entities. And this lead to miscommunication or lack of communication between the partners. For the third time, the standards of accreditation or evaluation of medical schools are not concentrating on the impact very much. So it's a challenge because we all work for accreditation. I mean, students study for the exam and medical schools do the work for the accreditation. This is a normal thing. So unless we have those changes in standards, it will be a little bit challenging to adapt social accountability. And the multiple stakeholders on health or for health is also a challenge. So these are the challenges in general, but maybe we have some challenges which are specific to each school or to each place. Maybe we need expertise on changing the curriculum. We need expertise on developing the assessment system. We need expertise in research. So it it will be different from place to place. The final thing, or the last thing, that social accountability is a strategy impact, that we think about medical education as something that should have an impact on the health of the societies by improving the health of society, by producing relevant workforce, and to consider the social capitals in education, and to have collaboration, retention of graduates in places where they are trained, and also we have impact on the economical development of the societies, because if they are in a good health, definitely they will have good economical development. The medical schools should be friends with the society. And this is the last thing that I can say. And thank you very much for your listening.
Thank you very much. That's a wonderful talk. There's so much enlightening on the topic, and you have touched the topic in such a nice way to highlight the importance of this aspect when we are looking into curriculum accreditation, looking into cost and deciding what to teach and how to teach. So I would request participants, if they have any questions, you can unmute or can ask, or can write your questions in chat box. Any questions? Well, we are waiting for question. Till that, I have one question, Dr. Hassan. As you mentioned that I'm basically curriculum developer, and I'm much interested whenever we are looking into curriculum, that how to amend curriculum. And in Saudi Arabia, if we look into VN 2030, and there is now a concern that yes, we have to touch this aspect, that patients are stakeholder of education system, and we have to take their opinion, and we have to look into their consideration, what to be taught and what not to be taught. So at undergrad level, once we are teaching different courses, social accountability should be taught in specific course, or it should be overall distributed among different courses in the form of highlights or in the form of scenario. How you can help us or guide us, being medical educator, how we can modify our curriculum in order to inculcate this social accountability into undergrad curriculum?
Yeah, social accountability should be the spirit of each course.
Okay.
Maybe if as I mentioned, if you have a course of social accountability, then it will be a course.
Okay.
The same as with professionalism.
Right.
If you have a course on professionalism, people will study to have A in that course, and they will not have the desire to be professional, for example, okay, yeah, or to apply professionalism. Social accountability is the same. So when you write a course, for example, on cardiopulmonary course, so you need to have the spirit of social accountability in that course. What are the priority health concerns related to cardiopulmonary? How can I put it in a way that the students will feel the importance? What are the expected changes in cardiopulmonary health later on? And we need to have the students know it. I give you an example. I work with the military College of Medicine to build their curriculum. So in a problem with TB, tuberculosis, we put objectives on how can you evacuate a TB patient from a military camp.
Okay.
So they study as the TB in terms of microbiology and all those things. but we add those objectives, and here this is the social accountability. Because they are serving the society of the military, so we put or we add some objectives so it can reflect the need of that society. So this is the issue. So you need to have the spirit of social accountability in all courses, and by default, inshallah, the students will have that spirit and they will take it after graduation.
Yeah. Thank you so much. Yes, Dr. Hassan Darami, he raised hand. Yes, please.
Thank you very much. Dr. Muhammad, I just wonder, as a medical school, what we can learn from the other non-medical schools, such as engineers, science, whatever those other schools, in the concept of social accountability. Thank you.
We can learn a lot, and we have a discussion right now on different levels that we need to move from interprofessional to interdisciplinary. I'm now participating in a course called Healthy Cities. Healthy Cities is run by engineers with doctors together, because how to develop or how to construct the buildings will affect health. And if you look to the health, it is linked to all disciplines. So if we can move from interprofessional to interdisciplinary, that is like the top aim. But let us try to have interprofessional first. Let us talk to our cousins first, or to our brothers first, and then we go to the cousins. But it's important to think about this, Dr. Hassan.
The idea came because I've been across some of the courses. I just learned that how the architects, they're playing a big role these days in educations, how to formulate the education. It's not just you building a class, you're creating a small group discussion room. It goes beyond that, from the building, from outside, from inside, from the distribution, and the open concept and so forth, with the no barriers. For example, you rightly said that we're still struggling with the interprofessional, right? Education or training. But how about if we can have a place where we have an open concept without any barrier? Probably this would lead to slightly different approach in the future. I don't know. Thank you.
Yes, I agree with you 100%, and we should work for that.
Yeah. Yes, Dr. Hatim Muhammad.
Okay. Thank you, Dr. Muhammad, for the nice presentation. You have just touched on the importance of integrating the social accountability in the medical school curriculum. Do you think it's high time to include or to integrate the medical humanities as a part of the medical school curriculum? And in my view, I think this is more to pave the way, or more related to social accountability, because I think this is one of the things that is missing in most of the Arab medical school curriculum. Do you agree with that, or you think it's differently from the social accountability?
No, I agree. And if you in one of my slides, I mentioned that the curriculum has two parts, which one is core and one is elective, and the electives where the humanities should be there and should be changing, and we have to have the flexibility to change in the curriculum every now and then according to the needs. We have a core, which is that thing that we know about anatomy, physiology, those things, but the electives where we can include humanities, we can include the studies of diversity, studies of social inclusion, and all those things in our curriculum.
Okay, thank you.
There is one question by Prof. Naila, that in medical schools, all concepts identified as essential for social accountability are essential part of community medicine. So probably this is just her comment. Dr. Mariam, she has mentioned in chat that does this mean that we should concentrate on diseases in our society rather than common cases elsewhere, or we should study all?
You cannot study all, definitely, because but you have to prepare the students for things that he can do on his own. I mean, you give them the way to learn rather than to give everything. And even if you cannot tell where are they going to work.
Yeah.
They may leave for another country. And nowadays, there are medical schools which are 100% international.
Yeah.
So there are people from everywhere. So the idea here that we need to set the curriculum in a way that they can touch on the local community, but they can work everywhere.
Yeah, that's great.
So they study locally, but they can have impact globally.
Yes, Prof. Khalid.
Well, thank you, Dr. Muhammad, for your talk, and also bringing this issue, which is very topical and important in our society. I just would like to touch the importance of the Aspire initiative, which is one of the international awards. They have one of the themes, social accountability, and as founder of this Aspire and as a member of the themes, one of the difficult theme in this Aspire, the assessment and social accountability, and so many schools they applied for this Aspire award, and they didn't reach the standards. So my recommendation for people who wants to enrich and activate this issue in their schools to get use of the criteria of social accountability, just to go through it with the team responsible about social accountability at the level of the school, because it is really well written, and they can apply so many things related to the schools, whether they want to apply or don't apply. But I'm sure they will get so many things that sometimes we didn't touch it in our day-to-day practice. Thank you.
I agree with you, Prof. And I talked with some people who applied to the Social Accountability Award in Aspire. They didn't succeed, but their reflection is that it improved their practice very well. So even if they are not successful in having the award, but they think that their curriculum has improved, the way that they are think about the social accountability use is improved. So I hope everybody can go through it and have a self-study exercise, rather than even if they don't want to apply. But definitely they are going to have a lot of insight about how to be socially accountable.
Thank you. Yes, Dr. Abdurrahman Al-Mahbub, you can ask question.
Thank you, Dr. Muhammad Hassan, for this comprehensive and nice presentation. Thank you a lot. I'm asking in regard to be socially accountable as a medical school. What can I do? As we know, we set priorities to a community services plan or activities done by the staff. We set these priorities by do an research for the community, doing a Google form or a questionnaire, whatever the tool we need. So what about social accountability? Is there any way to put a strategy or plan to do activities regarding social accountability?
If I understood you well, to be social accountable, whether in the curriculum or in the research or service, you need to work with the priority health concern of society. It is not problems, because the concerns different than problems. I will give you an example here. In Canada, they did a research for a whole county. They asked them, what are the characteristics of the doctors that you want us to graduate from our College of Medicine? To be knowledgeable comes at the bottom of the list. They said, we want a doctor who can empathize with us, who can communicate well with us, who can do something. So if you apply those results on your curriculum, you will find that you are missing a lot that you do not teach to the students. And this is how the community evaluate the doctor. So the community, they don't know if you have A in anatomy or A in physiology or A in that. They know if you communicate with them well or if you explain their disease to them. The other thing, how do we usually set the problems that we teach the students? Usually we go to the records. We see the records in the hospitals, and so we have this prevalence or this incidence is high and we include them. But we forget that 70% of the health problems are not in the hospitals or the health centers. So how to do the need assessment is the key. If we follow the same way that we are doing right now on going through the records, or it's our knowledge about the society, then we come up with health problems, with diseases.
Yes.
But we don't need to address only diseases. So the way that we do the need assessment should change. And the society whom we decide on behalf should be part of the table.
Yes.
This is the key.
Yes.
Thank you. Another question in chat box is that, can we consider teaching medicine in the language of community as a challenge for applying social accountability in that community?
Yes, sometimes. For example, when one of the problems faced by doctors in country like Australia, for example, Northern Australia, that the doctors, they cannot understand the language of that place, of the Aboriginal people. So in 2019, we were there and we found volunteers. They make like courses to teach doctors about the common language and phrases that are used by patients in their own language. And they make research on that, and they found that the doctors who speak the language, or at least they know the common phrases and the common body language, the impact, their impact on their patients improved. But as I mentioned, medicine is a global science. So we cannot say that we teach students, for example, in Arabic and without having any knowledge about English. We cannot say this, because They are going to do postgraduate later on, but definitely to know a language of a people is more important in communication with them.
Yes, thank you very much. So I think we have addressed all issues, and I would really say thank you to you for this wonderful presentation and for enlightening. It was full of thoughts for all of us to think that now how to apply all of this knowledge at our own levels wherever we are working, and how we can promote social accountability into education system, because this is must. So I would like to thank all participants, and would request we have shared one feedback for link for SESME webinar. So please, all participants, they are requested to fill this form. And thank you, Dr. Muhammad. Hope to see you again in some other webinar. And thanks for your precious
Thank
time.
you very much, Dr. Shazia, and thank you very much for the invitation.
Yeah.
And I will be very happy to be with you at any time, inshallah.
Yeah. Okay. Thank you. Goodbye. Goodbye to all.
Bye. Thank you very much.